In the Philippines, Ifugao province is known for its majestic mountains, ancient rice terraces and strong indigenous customs. Isolation carries risks. Women traditionally have given birth at home, where labour complications can be fatal. But childbirth is becoming safer with the establishment of community birthing centres run by skilled midwives. There are still women who live beyond the reach of health workers and can't get to a clinic easily. At her home, deep in the hills, Adela Manuela went into labour at night. She delivered baby Jessa at dawn on her own. Soon after the birth, midwife Olivia Punihik arrived on foot to look after mother and baby. Both were okay. Adela was lucky. In the same village 2 years ago, another young mother bled to death after giving birth without medical help. The woman died from a postpartum hemorrhage. They started to carry her to the clinic, but they'd waited too long. It was too late. From Adela's village, the nearest clinic is a 2-hour trek over mountain trails. Geography is a major challenge to getting more women to give birth in safe settings, according to Ifugao's Provincial Health Officer, Dr. Mary Jo Dalawan.
We still, with the mountainous terrain, we still have to construct more birthing centers, especially in the remote areas, and to develop them, and hopefully it will be accessed by the people.
Ifugao has already made progress. Mothers in less remote communities around the capital, Lagawe, can now deliver safely in modern birthing centres set up by local authorities with support from UNFPA, the United Nations Population Fund. Midwives like Elsa Pagal have been trained in essential obstetrics and newborn care. The midwives who come from the community work hard to persuade women to use the new facilities.
During prenatals, I advise all mothers to please come to the clinic for delivery.
The newly deployed midwives offer prenatal exams, deliveries, postnatal care, infant immunisations and family planning advice for couples. Midwife Irene Kimiyong doesn't take any chances with women's lives. She wants Michi Pugong to go to the provincial hospital to give birth. When I measured the womb, I noticed it was big because she's expecting twins. As a first-time mother expecting twins, Michi has a greater than normal risk of labour complications. Indigenous leaders have embraced the modern delivery practice, even though traditional beliefs remain strong here. Manuela Hogang is a local official and healer who summons ancestral spirits to treat various illnesses. To ensure a healthy birth, she advises pregnant women to hold a customary ceremony at home before going to the clinics. We go to church, we perform the rituals, and we go to the clinic. Our culture allows this. The midwives have taken the place once held by traditional birth attendants who were not trained to handle emergency cases. Carmen Dinugong delivered babies in women's homes for 50 years. When something went wrong, she would call a baki, a traditional priest. The baki performed a ritual and offered some chickens. That usually solved the problem. A local law created volunteer teams to promote the new maternal care services, adopting local traditions. When a woman goes into labour, volunteers are ready to carry her to the clinic in a hammock, known locally as an ayod. Thus, the teams are called ayod community health teams.
In the ayod team, they have so many members wherein two will carry the hammock, and then the others carry the packs, and then the food, and then other things which we will use in the clinic.
The volunteers can borrow from a credit fund to invest in activities like animal husbandry and vegetable farming. The interest helps pay for community outreach efforts.
I plant here beans, corn, eggplant.
Clients are responding to the outreach. In Elsa's community, virtually all mothers now give birth at the centre. Nursing student Jane Marie Ayok is expecting her first child.
When we came here, it is safe, feeling safe when having delivery here. Our midwife is always there to take care of us anytime. She's always here for us.
Every day, 11 women in the Philippines die during pregnancy and childbirth, according to government estimates. Today, childbirth is getting safer, providing better access to skilled health providers and culturally appropriate, safe birthing facilities could save most of those lives. With support from UNFPA, Ifugao is showing the way. This report was prepared by William A. Ryan and Mark Westhoff and narrated by Ella Callan.